NSAID, non-steroidal anti-inflammatory drugs for dogs and cats. You may not be getting the right information about these drugs, and this is stuff you should really know. I'm having a brand new webinar, you're invited. We're covering 95% curcumin, plus natural anti-inflammatories that are safe and effective for your pets. Click the link in the box below to sign up. The anti-inflammatories prescribed for our pets, they're called NSAIDs, non-steroidal anti-inflammatory drugs. 6 are currently approved by the FDA. Metacam, Rimadyl, Deramax, Previcox, Galliprant, Onsior. Millions of dogs, even millions of cats, every year are given non-steroidal anti-inflammatory drugs. Most commonly, we have a dog in pain. Little Tula, she hurt her shoulder last week. Like, one of the first things I did give her for a one-time use was a non-steroidal anti-inflammatory drug. I gave her some of this, some Metacam. Your dog's in acute pain, you want to get your dog out of pain. So clearly they have a purpose. But what I'm seeing now is with animals just in for routine surgeries, maybe a minor amount of discomfort, could be looking at some alternative painkiller, they're also going home with NSAIDs. They're one of the most, if not most, prescribed veterinary medications, but they really do come with a host of potential side effects. And I don't think most people are fully aware of that. Exactly how are they working? All these non-steroidal anti-inflammatory drugs, they're working on prostaglandins. So when a cell is injured, i.e. little Tula hurting her shoulder, a cell gets damaged, it releases the COX or cyclooxygenase enzyme that results in the production of prostaglandins. Prostaglandins, they're playing the biggest key role in pain and inflammation. You decrease the amount of prostaglandins, you have less pain and inflammation. It's going to be a good thing, right? The prostaglandins also have beneficial effects throughout the body. They're important in the intestinal tract. They help protect the stomach and the intestinal lining. They help to maintain blood flow to the kidneys, ensuring adequate kidney function, especially if blood flow happens to be decreased to the kidneys, such as in dehydration or anesthesia. Prostaglandins, they help ensure platelets function normally. These are a key part of the clotting system. When you have platelets that aren't working properly, if you're injured, you're going to have a much more difficult time clotting. Same thing is happening with our animals. The side effects of the NSAIDs, they're directly related to decreasing prostaglandins. Most common are the GI signs: vomiting, diarrhea, decreased appetite, decreased energy levels. Other more serious clinical signs, these include ulcers, kidney failure, liver failure, even death. The NSAIDs, such as Metacam, number 1, they're directly irritating to the stomach, the intestinal tract. Number 2, with the decrease in prostaglandins, kind of like a double whammy in the intestinal tract. Hence, that's why the most common side effects are GI. The vomiting, diarrhea, decreased appetite, decreased energy levels. But then not too far away can be much more serious clinical signs where you can progress to a stomach ulcer, an intestinal ulcer. And this is easy enough to happen. Say your dog happens to be prescribed the Metacam, he's also on prednisone. Those in combination can directly lead to an ulcer. How about with the kidneys? Well, the kidneys are especially sensitive when they have decreased blood flow. This can happen if your pet is under anesthesia, if your animal is dehydrated, if your animal has pre-existing kidney disease. And what the kidneys are depending on are prostaglandins to increase blood flow to the kidney. But if you're to give your dog or your cat some Metacam, you can decrease prostaglandin levels, you're going to decrease blood flow to the kidneys, and it can directly impact the kidneys. Just giving an NSAID drug like this at the wrong time, dehydrated animal, can lead to acute onset of kidney failure. How about your pet's liver? If you give your dog or cat an NSAID, the liver is the main organ which is processing this anti-inflammatory drug. So if it's given at the incorrect dose, your animal is dehydrated, they have pre-existing liver disease, right, you can really seriously damage their liver. I need to make a note about our cats because they're at even such a higher risk. The FDA, for instance, they've only approved that you can give Metacam via an injection to a cat for one time. But I suspect that many of you even watching this video, you've had cats that have been prescribed an anti-inflammatory drug, and they've gone home with that drugs. Guess what? That is off-label. That is not approved by the FDA. Cats are not small dogs. They metabolize these drugs much differently. So you give your cat this NSAID, you decrease prostaglandin level, you decrease blood flow to the kidney, and that can produce acute kidney failure. Clearly, you need to balance risk versus reward. Your animal is in acute pain. Obviously, you need to get your dog or your cat out of pain. I have anti-inflammatories at home. Tula was in serious acute pain. I gave her CBD. She was somewhat alleviated, but she's still really uncomfortable. So there is a great use for this drug, meloxicam. But a day later, she's feeling much better. So like, does she need to stay in that meloxicam? In my opinion, no.
So then you really need to be considering some of the safer alternatives.
Cannabidiol or CBD, it is a great natural alternative providing some wonderful pain relief. Plus, most dogs and cats really like it. Here you go, Tula. Here's your CBD. Then long term, consider a natural anti-inflammatory painkiller that is safe without those side effects. 95% curcumin is a great option. That's my 2 cents on the NSAIDs for dogs and cats. I hope that gives you a little bit better understanding of how these drugs work, the risks associated with these drugs, how you can safely use them, some of the alternatives without those side effects. Last but not least, I really encourage you to sign up for my brand new webinar, 95% curcumin for dogs and cats, plus my top natural anti-inflammatories. You can click the link in the box below to sign up.